Hi, this is Dr. Daniel Chong, vital-human.com. Wanted to talk to you today about a video I just finished listening to from a friend of mine who's a functional medicine doctor. And in the video, he basically was expressing his dismay at the approach that a lot of his functional medicine colleagues have been taking lately in prescribing certain medications in a similar fashion to how MDs prescribe them. And of course, the one that caught my ear was when he talked about statins and how he was quite upset about how a lot of functional medicine doctors are now recommending statins as part of the treatment for preventing and reversing cardiovascular disease in their patients. And he made certain comments like, statin deficiency is not the cause of cardiovascular disease, and especially most importantly, statins inhibit an enzyme called HMG-CoA reductase, which is the rate-limiting step for cholesterol synthesis in the liver, and how dangerous that can be because there are other substances, for example, that also are made via the same enzyme that may also become inhibited by if you're using a drug that's inhibiting that enzyme. So one of the examples is coenzyme Q10. So his point was it's dangerous to inhibit this enzyme. It's unnatural. It's going to lead to other deficiencies potentially. And cholesterol is an important substance for life, as we all know it. And so we shouldn't be unnaturally inhibiting it that way. We should take other approaches towards cardiovascular disease like lifestyle, diet, etc., potentially supplements, things like that as a means of getting at more appropriate angles of reducing risk. And again, I don't disagree with anything that he's saying in terms of these other things that we should be doing to help people in a setting of cardiovascular disease. And I'm also not like a big statin pusher. I try to help people stay off of them if at all possible. But these days, I do not any longer have a line in the sand where I don't ever cross it, in the sense that I do think there are certain circumstances where they are appropriate and can be very helpful to people. But the point that I wanted to make in this video is I thought it was really interesting to consider the fact that, again, this friend of mine and many other people out there who have similar commentary oftentimes talk a lot about this enzyme, HMG-CoA reductase, which is, again, the enzyme involved in cholesterol synthesis in the liver, and how dangerous it can be to inhibit that. And yet, at the same time, it is also interesting to consider the fact that many of these people are likely not aware that there are many things that actually inhibit HMG-CoA reductase, including very likely certain supplements and other food-based extracts and things like that, that many of these people are likely prescribing to their patients, sometimes also directly in their effort to help them treat or prevent cardiovascular disease. So, for example, probably the most well-recognized natural substance that inhibits HMG-CoA reductase is vitamin C. And I'd be hard-pressed to find any functional medicine doctor out there who doesn't typically recommend vitamin C to their patients. Other substances to consider: garlic, turmeric, I swear there's one more, but I can't remember. Oh, artichoke. These are all things that are oftentimes found in various natural supplements for various health issues, including certain supplement formulas that are made to help reduce the risk for cardiovascular disease. And again, these people are coming at this from this perspective like these are natural, they're doing other things, they're anti-inflammatory, they have other nutrients and things that are helpful to artery lining, healing, and things like that, all of which are true. But they also have been shown to lower LDL levels and to do so via inhibition of HMG-CoA reductase, just like statins do. Now, of course, statins are certainly more potent in doing what they're doing, and that should be a consideration. But this whole notion that we should completely blackball this one treatment approach because of this specific mechanism is a little bit strange to consider when you think about the fact that very likely multiple things that many of these practitioners are giving their patients are having similar effects, and if and when they see their LDL levels come down naturally from the natural treatment protocols that they have them on, some of that is very likely occurring due to a direct inhibition of HMG-CoA reductase. So I thought that was really interesting to consider, that, you know, we really shouldn't, in my opinion, shouldn't be having a line in the sand that we never cross over. And I always tell my patients, basically, the bottom line is we're trying to prevent heart attacks and strokes and early death from cardiovascular disease with you, and we're trying to do so as safely as possible. And that's the bottom line. And there's a spectrum of possibilities as we try to do that, the far end of which are the most potentially harmful side effect causing treatments that we should obviously, for good reason, avoid if at all possible. But we shouldn't be operating via a model that keeps us from ever considering those. And to me, a true functional medicine doctor or naturopathic medicine doctor should be thinking from that perspective. Everything's on the table. Stay as natural as we can and healthy as we can, and move down that spectrum as needed for the health of our patient as the top number one priority. The last thing I'll mention that was also an interesting thing to consider is there's a lot of concern out there as to, like, well, what is too low? If we give people these medications and their LDL levels go down lower than we typically see in people without them, that's got to be dangerous. We're going to be harming their ability to perhaps produce hormones or their brain health and different things like that. If we give them to younger people, we might harm their development, so on and so forth. So I wanted to also just show you briefly this clip from another, or not a clip, but this screenshot from another study I found, looking at a group of people who had a unique genetic mutation that, I won't get into the technical details, but long story short, the genetic mutation leads to them having very, very, very low LDL levels, under 20. And as you can see here, these people are not typically affected negatively in any way that they're able to tell. There are some other genetic defects that so severely almost bring cholesterol levels to zero that can certainly cause health problems, but there are these other genetic mutations that don't do it quite that much, but do it more extensively than we're almost ever lowering levels to via drugs, and yet we see no negative effects with these patients. So hopefully that all makes sense. Again, the goal is simply your well-being, and you should hopefully not be operating from this perspective of, like, yeah, okay, I'll do anything up to this level and then I'm going to stop, because that can harm people. And again, as long as you're having the perspective of only go further down that spectrum if needed via a good risk-benefit analysis, that's going to do the best for you. So hopefully that helps. Thanks for listening again. Daniel Chong, vital-human.com. Have a good day. Bye-bye.